Hi, my name is John Nolan. I'm a student of American Foreign Policy at Seton Hall University, where I'm attending graduate studies in international diplomacy with an emphasis in global health. The topic of my expert brief is the global health security agenda. Rising populations and globalization is giving new patterns of health and disease that is linked to restructuring human societies. Changes arising from globalization can be understood to extend to the field of public health in three distinct ways. First, processes of global change are shaping the broad determinants of health, such as employment, housing, education, water, sanitation, agriculture, and food production. Second, a growing body of evidence indicates that health status and outcomes are being unpredictably influenced by globalization. Within these globalization patterns, the spread of re-emerging and new diseases is occurring. Consequence of the two factors mentioned above are driving societies to adapt their collective responses to changing health determinants and outcomes. Viruses and diseases know no borders. A virus or disease threat anywhere globally can quickly become a pandemic danger in today's interconnected world. More than most, virologists, scientists, and public health officials recognize that viruses and diseases can exploit even the smallest opening and spread through the ease and speed of global travel. Contemporary air and ocean transportation modes have become the transmission routes for a virus or infectious disease, capable of reaching major metropolitan areas in as little as 36 hours. For the United States leaders and policymakers, the ability to shut down the transportation modes and access points into the United States is becoming increasingly more important than ever before. Another factor is international travel typically terminates or originates in metropolitan cities with large population centers. These cities are often referred to as megacities. The United Nations defines megacities as a city with a population of 10 million inhabitants or more. In and of themselves, megacities experience public health challenges and other social maladies that will only grow as the world population is expected to increase over the next 30 years. In 2018, there were 37 cities classified as megacities. By 2030, the number of megacities is expected to grow by 4 to 41, and the world landmasses will become even more urban overall. To address this overall trend, the most effective way to provide health security to Americans from health threats that begin overseas is to stop them at the source before the virus becomes to the United States. The United States frontline warriors for health security are the employees and scientists of the Center for Disease Control and the United States Health Human Services Office of Global Affairs diplomats working with the World Health Organization, the International Health Regulation Organization, the World Organization for Animal Health Performance of Vet Services, the Food and Agricultural Organization of the United Nations, the Interpol, as well as an array of other government agencies such as the European Center for Disease Control, just to name one. Additionally, other non-governmental organizations stakeholders, such as the Bill and Melinda Gates Foundation, participate and support the global health security effort. The CDC, as an integral member of what I would refer to as the Transnational Health Organization, along with other global non-governmental partners, are advancing the global health security agenda and providing health security not only to the United States, but to the other countries around the world. Although health security has been on the horizon for those nations who realize the vulnerabilities associated with globalization and the emerging infectious diseases threat through actually experiencing contagious outbreaks such as the 2009 influenza outbreak, the severe acute respiratory syndrome SARS, or the Middle East respiratory syndrome MERS outbreaks, and their seemingly ability to quickly spread with deadly consequences and having a negative economic impact. Observations had shown that independently, countries were unprepared or incapable of dealing with unknown viruses and epidemic outbreaks. However, a greater collaborative effort and urgency was inspired by the Ebola crisis that unfolded in Western Africa in the late spring, early summer of 2014. In early 2014, the Global Health Security Agenda, with central support from the United States, was launched to advance the goal of a world safe and secure from infectious disease threats and to bring together nations from all over the world and to make new concrete commitments and to elevate global health security to a priority at the national leadership level. By July 2014, the organizers came up with the Global Health Security Agenda framework, Prevent, Detect, and Respond, To achieve the overall goal, the framework established 11 lines of effort or defined targets to facilitate national, regional, and global collaborations among technical experts towards the goals and objectives. The purpose of the Prevent, Detect, Respond framework were: 1. Urgently accelerate measurable actions on national, regional, and global basis. 2. Provide for specific coordinated actions in support of the global health security agenda. 3. Highlight targets, provide accountability, and achieve a measurable approach. And 4. Illustrate a mechanism by which countries can make specific commitment and take leadership roles in the global health security agenda. Participating countries committed to either lead, co-lead, or actively collaborate with other countries regionally or globally to implement a unified set of action packages. These health security action packages or efforts included 5-year targets, indicators to measure progress, desired impact, country commitments, and long-term actions. The targets included lists of baseline assessments, planning, and evaluation activities to implement the action items. The Transnational Health Organization associated the targets with the framework. As exemplified on the slide, there are 4 action packages associated with PREVENT: antimicrobial resistance, zoonotic disease, biosafety and biosecurity, and immunization. There are 4 action packages associated with DETECT: National Laboratory System, real-time surveillance, global health security agenda reporting, and workforce development. Finally, there are 3 packages for RESPOND: emergency operations centers, linking public health with law and multi-sectorial rapid response, medical countermeasures, and personnel deployment. In today's ever-rapidly changing complex global environment, global health security is a country and a society's ability to prevent, detect, and effectively respond to disease threats. For the United States, this means protecting the economy and national security through safeguarding against disease outbreaks. To this end, CDC is collaborating directly with other countries to identify disease threats, train partner country healthcare workers to detect outbreaks at the source, and respond to outbreaks before they become widespread and disrupt markets. To illustrate this point, the CDC, in cooperation with the Republic of Georgia health officials, assessed their country's progress towards achieving the target. The CDC's work abroad is critical to the public health effort to protect citizens in the United States. As stated earlier, the goal is to stop disease where they occur as soon as they start. As the United States has recently observed, the CDC's global activities have informed and protected Americans from major health threats such as pandemic influenza, Ebola, and more recently, Zika, a zoonotic virus transmitted through a species of mosquito. As many Americans prepare for the seasonal influenza, colloquially known as the flu, by getting the vaccination, many U.S. citizens will not. Based on historical trends, it is estimated that roughly 53% will not get a flu shot. Given the seemingly high mortality rate caused by influenza, one should get the vaccination. CDC is currently keeping a close watch on the flu after the highest number of deaths from influenza virus was reported last year since modern tracking began. At the end of October 2018, the CDC director went on television recommending everyone 6 months or older receive a vaccination. Unfortunately, his television address was too late, at least for one young child residing in Florida who was not vaccinated and who became the first casualty of the 2018-2019 influenza season. The CDC director further went on to advocate that the most powerful tool available to eliminate disease is the vaccination. As most Americans have experienced at one time or another, seasonal influenza is an acute, highly contagious respiratory disease caused by any of 3 orthomoxy viruses. Depending on the symptoms, this could denote either an epidemic or a pandemic. Although numbers killed by the flu last year is difficult to determine, CDC official preliminary estimates are that the 2017-2018 winter flu epidemic killed 80,000 Americans. The 2017-2018 flu epidemic has significantly surpassed the 1976-1977 flu epidemic, which was estimated to have killed 50,000 Americans. Although none of the recent flu epidemics have surpassed the Spanish flu pandemic of 1918, which is estimated to kill 50 million, the seasonal flu is one example of an epidemic that illustrates how quickly a virus can spread around the world and have a global impact on health. As another example, of the challenges facing health professionals in the global health security agenda is urban sprawl. Even in a city with purportedly high standards of living, Los Angeles City, California, with the fourth busiest international airport gateway in the world that boasts 81.9 million travelers annually in 2016, and with a population exceeding 11 million, experiencing epidemic-level outbreak of murine typhus, a vector-borne disease that is spreading through an ever-growing homeless population. The health concern is not limited to one city. According to a May 4, 2018 CDC Vital Signs report, vector-borne diseases is a large and growing public health problem in the United States. Vector-borne diseases are characterized by geographic specificity and frequent pathogen emergence and introduction transmitted through animals and insects through touch or bites. The predominant carriers that transmit diseases are ticks and mosquitoes, which draw blood from animals and transmit by biting humans. Differences in distribution and transmission dynamics of tick-borne and mosquito-borne diseases are often rooted in biological differences of the vectors. To effectively reduce transmission and respond to outbreaks requires major national improvement of surveillance, diagnostics, reporting, vector control, and vaccines. As a final example, some viruses, such as the measles and rubella that were on the brink of eradication in the United States, are now making a comeback by way of unwitting carriers from overseas. Measles are common in Africa, the Pacific, Asia, and even in European countries. Since 2017, though, the European Union of 30 countries experienced its largest outbreak of measles, and it is continuing to spread due to suboptimal levels of vaccination. Travelers from Europe and other regions mentioned with measles continue to come to the United States and encounter groups of Americans who are unvaccinated. Such was the case of the 2015 measles outbreak that started in California amusement park after the index patient 0, traveled to the Philippines. In conclusion, as was pointed out at the start of this briefing, the broad determinants mentioned in the effect of global change will require collaboration across all societal sectors in order to detect threats early, prevent regional and global catastrophes, and respond rapidly and effectively, thus providing global health security. As a final note, perhaps the Achilles heel of the global health security agenda, and as I have illustrated through my example, is that even with the aforementioned sophisticated and elaborate global health apparatus between nation states, the global health security agenda is unable to, at the community level, encourage people to willingly get a vaccination or practice hygienic prevention methods. The individual steps in getting a vaccination or practice safe hygiene boosts herd immunity, thus protecting those with compromised immune systems and the vulnerable, such as young children and older citizens. It is everyone's responsibility to achieve global health security. This concludes my brief on the global health security agenda. Thank you for listening. I look forward to your comments.